I think we've made a huge mistake turning this all into queer theory as a queer theory movement rather than a science-based medical understanding of gender dysphoria, because not everyone is ever going to agree with queer theory, and so it seems like we've built this whole castle onto sand, right? Whereas I know people they say, well, we don't want to pathologize this, we don't want to stigmatize it, but there's lots of conditions out there, and our goal is to educate and destigmatize certain conditions, not completely deny that the condition exists. And so I'm just curious. I think it would do all of us a lot of good if we could just land on what do we know about this, what is it as a clinical condition, and not define it according to any political movement or ideology.
Welcome to the Unspeakable podcast. I'm your host, Meghan Daum. My guest, whose voice you just heard, is mental health advocate and clinician Erin Kimberly. I'm going to introduce Erin properly in a second, but first I want to offer some context for this conversation and explain why I'm releasing it this week. If you're familiar with this podcast, you know it's not one of those podcasts with the big monologue before the interview, but I am going to do a sort of mini monologue to frame this up. So I'll say that if you want to go right to the interview, you can skip ahead now about 8 minutes. Okay, so last week, there was an article in the New York Times that probably didn't make a big splash among the general reading public, but there was a huge deal for people who closely follow the subject it was covering. That subject is one I've discussed on the podcast several times: treatment protocols for young people who identify as transgender and come into gender clinics seeking things like hormone blockers or cross-sex hormones. The reason this article was significant was that it was essentially the first time a news organization as influential as the New York Times had, at least in a reported article, not in an opinion piece, lent credence to the idea that a treatment model for trans-identifying youth known as the affirmative care model is possibly not the best approach. Now, by affirmative care, we're talking about the idea that people, including children and adolescents, who come into a clinic saying they have gender dysphoria and are in fact transgender, should be taken at their word and prescribed hormone therapy without extensive and, in some cases, really any kind of psychological assessment. The article, which happened to feature the psychologist Dr. Laura Edwards-Leeper, who's appeared on 2 editions of this podcast, reported on the fact that more clinicians are beginning to push back on this model when it comes to young people. In fact, the World Professional Association for Transgender Health, or WPATH, which is the organization that sets the standards of care for doctors and therapists treating transgender people, recently released a draft of an updated book of guidelines, which for the first time included recommendations that adolescents have a comprehensive psychological assessment before being put on a medical path to transition. Again, if you don't follow the subject closely, that approach might sound like a no-brainer. But in fact, those are fighting words to a lot of trans rights activists. And since those activists have largely set the tone for mainstream media coverage of this issue, it's a big deal that the New York Times ran the story. Although I should say that the story also included remarks from clinicians who see required psychological assessment as an undue burden on an already distressed population. The article was pretty straight down the middle, which, when it comes to the subject, is actually pretty radical. Anyway, that was a very long wind-up to introduce this week's guest, whose voice you heard at the top. He is Erin Kimberly, and he is a mental health clinician based in Canada who has worked with trans youth in gender clinics and elsewhere, and is himself a trans man. Erin had nothing to do with the Times story or the WPATH guidelines. He is not even a member of WPATH, he tells me. In fact, we recorded this interview late last year, and my plan was to release it as part of another 3-part series in the vein of the gender nuance series I did last fall. Now, the question of why I wanted to do it that way is relevant, but also one I'm still not sure I'm able to answer. This subject has so many moving pieces and so many underexplored complexities and, yes, nuances that I somehow kept feeling like releasing a single episode wasn't going to do justice to the issue. Releasing just one episode in 1 week somehow wouldn't cover everything. But I think part of what was going on was that there were people around me in my real life, parents and teenagers alike, who were experiencing this issue in very different ways and experiencing my coverage of the issue, despite the excruciating care I took with it, in ways that caused them pain. So I guess I thought that if I covered every possible base, inoculated myself against every potential criticism in the form of 3 episodes dropping in 1 week, that some of that pain would be lessened. But the truth is, I think it was really my pain I was trying to lessen. I didn't want people to think I was a bad person. I didn't want friends of mine whose children were trans identified to think I was questioning the legitimacy of their child's perspective or questioning their parenting. It hurt me to think that I was hurting them. So, believe it or not, I tried to veer away from the topic. I was aware that people were starting to wonder why I was so, some might say, obsessed with the topic, especially because it doesn't touch me personally in any way. I'm not a parent, for starters. But even though obsessed may be too strong a word, it's certainly fair to say that I am fascinated by the current gender discussion. And since wide swaths of that discussion have less to do with trans people themselves than with a concept, a pretty abstract, often almost magical thinking kind of concept that has captured mainstream culture, even science and medicine, in a way that I think is pretty much unprecedented in modern history, I do think it's a subject worth talking about, even talking a lot about. And that is why I decided to post my interview with Erin Kimberly this week. The New York Times piece was noteworthy, but it was also notably timid, equivocal, I would say, and even inaccurate in places. It stated as fact, for instance, that detransitioning is quite rare, or actually, in another equivocation, that detransitioning is, quote, thought to be quite rare. We know that detransitioners are not rare at all. Just type that word into YouTube and you will learn quite a lot. You'll also, by the way, learn a lot from the reader's comments on the article. So I would encourage you to read those after you read the piece, if you read the piece. Anyway, I'm releasing my conversation with Erin because he is an example of the very sort of clinician who is speaking up against this affirmative care approach. As a trans man himself, he can talk about what he had to go through to complete his own transition 15 years ago. He talks about having a rare intersex condition and how that did and did not factor into his decision to transition. He also, like a lot of us did in the 90s, studied some queer theory in college, and he is very good at explaining how gender theory got tangled up with medicine and why so many well-meaning people have gone along with ideas that on a very basic level make very little sense. It's the kind of conversation that reminds me that it actually does make perfect sense to be fascinated with this topic. It's exactly why I love doing this podcast. And with that, and you can stop skipping ahead now, here is my interview with Erin Kimberly. Erin Kimberly, welcome to the podcast.
Hi, Meghan. Thanks for inviting me.
You're a mental health clinician. You've been talking about these issues, active in this space, as we say. Why? Why have you become vocal?
I'm the least likely person to be vocal about this. I don't, anyone that knows me knows that if I'm speaking publicly about this, because I'm usually a very private person, usually pretty quiet and stay out of the politics. So the fact that I'm stepping forward, I think, to anyone that knows me is pretty significant. And it's a bit of a long story, but I'll try to kind of just capture the highlights. So as you said, I am a trans man. I transitioned about 15 years ago, and and really haven't been involved in the trans community. I was initially, as I was going through the initial medical parts, in support groups and stuff, just because I needed that support. But for many years now, I really haven't been involved. I've got my tiny circle of friends, but I'm not involved in the politics, and I've moved away from the big city and have just gotten on with my life. And was working in general mental health for the last 15 years. And it was only recently that I took an interest in doing a bit of trans health because I was working at the time for a youth clinic, and we were seeing a lot of youth coming to our clinic asking for trans medical services. And our physicians in the clinic were only with us very part-time. A couple of them, a physician, nurse practitioner, did have an interest in supporting the population, but they're certainly not trans specialists, so they didn't want to dedicate their entire practice to the population, but they were interested in learning more about it and supporting these youth. But because they had very limited hours at our clinic, and the assessment process is quite labor intensive. It takes some time. And of course, I was thinking that the system was more or less the same as when I went through it. So when I went through it 15 years ago, there was an assessment process that took several months. And so I was under the impression that was still what was being done. And our physicians just didn't have the capacity to do that over several months. And so I said, well, as a mental health clinician with a lot of experience with assessment, at least the mental health parts, I could assess and come up with a report and put that time in as a full-time staff and support our physicians in that way. So they were very excited about that plan. So that's what we set out to do, was that I would coordinate the service and do the bulk of the information gathering for the physicians. And so it was a very efficient way of doing it. And we were working as a multidisciplinary team. And I was really excited about it because our clinic is multidisciplinary. We had the ability to support youth in a lot of different ways, from housing, social services, mental health supports, primary care, sexual health, all of those things. We could address and build a really comprehensive care plan for these youth to support them. So we reached out to the provincial health authority, who oversees the education for trans care services, and asked them for some training. And they came out twice to do training with us. And it became, and I was involved in a clinical listserv and a mentorship call that happened once a week. So we were really wanting to do the work well. And I was excited about it because I thought, okay, here's my chance to kind of look behind the curtain and see what this is all about. I was curious about, what is gender dysphoria and what is known about it, and really wanted to just understand that and was excited about it.
And these were things. Sorry to interrupt you. First of all, what year was this? How long ago are we talking? Just last year.
I mean, the clinic opened about 4 years ago. So we first had Transcare BC out to do a bit of training with us at the beginning, but that was very basic, just kind of, I would describe it as cultural sensitivity training, just, trans 101 of making the clients comfortable. But when we started doing the clinical work, we really wanted a deeper dive into that. So we invited them out again to do some deeper training with us. But it ended up being a very similar, what I would call cultural sensitivity training, priming as to the language that's used and making people feel comfortable. But I was finding it. Sorry, go ahead.
Actually, no, I don't mean to interrupt you, but when you say you wanted to find out what was behind gender dysphoria, that sort of thing, had that not come up when you transitioned? Was that not yet sort of in the lexicon?
Yeah, it was about a year ago that I started to get involved in supporting the physicians, just because of the volume of clients. We needed to do something. There weren't a lot of trans medical services in our area. So these youth were saying they had nowhere else to go. But I was becoming concerned by just how different the system of care has changed since I went through it. So, like I said, I was expecting it to take several months to do the assessment, and that's what I had been planning for. And I was being told, well, no, I mean, that's not really how we practice anymore, that depending on how much time you have to spend, if you only had 10-minute clinic appointments with someone, it might take longer. But if you could sit down with someone for an hour, it could maybe take a single visit. to do these assessments, and we were given a checklist to go through. It was a 1-page checklist. So what I understand this to mean now is that the model of care that was being presented to us as standard practice is what I would call an informed consent model, or some might call it a harm reduction model, where really there's far less emphasis on any kind of diagnosis to diagnose gender dysphoria as a condition of any kind. It's now framed more as a human rights issue and bodily autonomy. So anyone, for any reason, who wishes to start hormones and surgically alter their body, it's not really our job anymore to question that or to go exploring for motivations or to diagnose. It's more about they have the autonomy to identify however they wish and to access health services however they wish. And so the assessment that we were doing was only supposed to be for the purpose of determining whether they had the capacity to consent.
And were these people under 18?
That clinic was teenagers and up to early adulthood, up to age 25. So kind of some of them were sort of older adolescents. We didn't do any hormone starts. We didn't do any puberty blockers. Our physicians didn't feel comfortable doing that. They just didn't know enough about it. So we didn't do anything as far as medical interventions for the younger youth, like in the 12, 13, 14 age range. But we were doing hormone starts on older adolescents, and then surgery referrals for over 18.
Okay. And when you say older adolescents, still, are we talking about people who are over 18? Because I think there's a lot
under 18.
Under 18, because I think a lot of people say, well, there's this kind of social panic around young kids walking into clinics and being prescribed cross-sex hormones at like Planned Parenthood or something. But that doesn't happen. It's not true. It's not true. You're saying that this was going on. People under 18 getting cross-sex hormones. Yes.
Older adolescents, according to the model of care, older adolescents can be started on cross-sex hormones, and we were doing hormone starts for about age 16 and up. So I started, the more I was learning about this new model of practice, the more confused I was feeling, and I'm not trying to point fingers at any particular individual, because it seems to be much more of a systemic thing that's happened, where this model of care is being pretty widely promoted and practiced. But I started to just become very confused because and I'm not an expert on these things. I was trying to learn about this, but I was having trouble reconciling the clinical model with my experience as a trans man and in the community, and just the complexity within the community and the layers of different sort of mental health presentations, and hearing people over the years say things like, I have a friend who transitioned even before I did, about 20 years ago, and he's now saying that he still goes by male pronouns for the time being, but he says that he regrets a transition, that he feels that it had more to do with the sexual abuse he experienced as a child and a dissociative experience as a result of that trauma. So I hear stories like that. I hear stories about people saying, well, I just did this for political reasons because they were really into queer theory. I mean, I have known of queer theory professors who really identify with the idea of female masculinity and want to masculize their bodies as an expression of queer theory. I've heard people say that
they're actually medicalizing. Sorry again to interrupt you, but I want to make sure I'm understanding this. So, because this does sound like the kind of thing that is this hyperbolic, like the people get all like up in arms, like people are just doing this to make a point. But you're saying people have medicalized because of just to make some kind of ideological statement.
That's how she expressed it in the community was, I don't want to give away any identifying details, but she was very, very knowledgeable and very interested in, dedicated a lot of her energy into queer theory and really identified with the idea of female masculinity. So it didn't identify as a man. I mean, to what extent she may have had a legitimate gender dysphoria, I don't know, but that's not how she was presenting it in conversations. She was presenting it as she really believed in this theory. And others said, I've never experienced gender dysphoria in my life, and I lied my way through the assessment. So I don't want to cast the entire trans community in a bad light. I mean, even someone who maybe never had gender dysphoria and lied about it, I'm sure they have their motive, and I would be very curious, what that motive is and what purpose the transition served for them. Because I've certainly met lots of people with legitimate gender dysphoria as well who have felt some relief from the clinical condition. And like myself, I mean, I definitely had gender dysphoria from a very early age, and I've never bought into the queer theory stuff. I mean, I learned about it a little bit as a 20-year-old, but had long rejected it and left it behind. And I just see transition as treatment for a condition, and it was helpful. So I don't want to frame this as gender dysphoria isn't real, because it is, but I just know from my experience in the community that there are a lot of different drivers for why people want to medicalize their bodies and transition, gender dysphoria being only one of those reasons. And so when I have all these young people coming to me looking for support, knowing all of that background information, all the stories that I've heard from hundreds of trans people over the years, I really wanted to take my time to get this right with these youth and really explore all of these things. And some of these youth that we were seeing are very complex, maybe have autism diagnosis or ADHD diagnosis, and or trauma backgrounds. And I really felt like it was weighing on my conscience. It did not feel right for me to just rubber stamp them and move them on to permanent medical alterations to their body when there was that kind of complexity. And I just wanted to get to know them. But then the accusation came about that I was gatekeeping clients, which in the political world and those that advocate for the informed consent model, it's like a sin in the trans community. You're not supposed to gatekeep because that's somehow oppressive and harming people.
And who was accusing you of that? Was it your colleagues? Was it people in the community? Where was it
was
coming
some
from?
community activists and not colleagues within organization, but the provincial health authority and activists in the community. So the pushback didn't come from like the youth that we were working with. I mean, the youth themselves seemed pretty happy as far as the feedback that we got. They felt happy and comfortable with us, and so it's disheartening that now they're boycotting the clinic. I'm not even there anymore, but they continued to boycott the clinic, even though those youth, I think, were being well served and seemed happy with the service.
So yeah, that's interesting. So it wasn't the clients themselves who were complaining. Have you seen cases where young people come in and say they need to transition immediately, and you feel that is the right instinct? Is there ever a scenario in which that could seem plausible?
There were people for sure, there were young people that came in and they want, the hormones as soon as possible. And you see that they had that drive to do that. And I would just explain to them the rationale for why I think it's important to slow down and just talk about these things. And, and so one of the things that I said to some of them is, we're not just planning, this isn't just a hormone readiness assessment. We're not just planning for you to start hormones. We are planning for the big picture. We're planning for you to succeed with your goals. We're planning for you to be a healthy, happy, productive human being. So we want to get to know you well enough to do a really individualized care plan for you to address all the things that you're struggling with. If there's anything that we can support you with. So I would encourage them to just slow down, that we weren't trying to, gatekeep in the sense of saying you're not who you say you are. We just wanted to get to know them well enough to make sure that we were supporting them properly and safely. So most people, when you had provided them with a rationale of just developing a relationship with them, they might not have been happy to have slowed down a little bit, but we were able to maintain a good relationship with them, and they were happy in the end.
Okay. And what is your background as a clinician? What kind of mental health providing were you doing prior to this?
So I've always worked in mental health. I'm a registered nurse, but I've always specialized in mental health right from nursing school onward. And so I've been working 15 years, and I've worked in a number of different settings. I started in a psychiatric stabilization unit in a hospital, but that was becoming more and more like forensics and things like substance use, more so than mental health. I saw that change over the couple of years that I was there, and so that started to interest me less. So I left there, and I was doing some casual work on the other inpatient units, and I ended up landing in the provincial eating disorders program, where I started as a staff nurse. So we were running groups and providing medical support, and that really interested me. I really liked the team there, and I really liked the clients. And as a nurse, it was an interesting field because it was a merging of mental health and medical. I was there for a number of years, and then was in a leadership position for a while with that program before I then moved on to working with youth in the clinic. And my role in working with youth was more general mental health as well.
I've heard you talk about how when you were working with the clients with anorexia, that a lot of the nurse and the clinicians didn't want to work with that population. Like there was almost a fear around it.
Yeah, and I was really curious about that because when I was working in the general mental health units, there are times, because we were all one mental health program, and so there are times when one unit is short-staffed that they kind of do a shuffling of nurses throughout the department. And I just noticed a pattern that whenever that eating disorders unit was short-staffed, that nurses were really resistant to the idea of going up there. And I thought that was really, I'm always curious when I see patterns like that, like why do they have this resistance to going up on that and working on that unit? So it was my curiosity that took me up there. There was a temporary posting, and I thought, well, this is my chance to go up there and to see what it's all about. And I ended up really loving it.
So what's your diagnosis? Why are they so afraid? What's going on?
I still don't really know what that fear is about. Like, I don't know if it's their lack of confidence in some of the medical skills, maybe. Because when nurses work in mental health for many years, if you're not constantly using medical skills, sometimes you lose them. So that might have been part of it, but some of it too might have been some of the stigma around personality disorders. Maybe is my guess, because a lot of people with eating disorders also have personality disorders, and there is that stigma around it. So that's my best guess.
So at this point, were you aware of the rise in young people announcing trans identities? I mean, this cohort, I know that the term rapid onset gender dysphoria is very loaded, and people really, run in the other direction sometimes if you even use it. But, in lieu of a better way of isolating that, how aware were you of this kind of cultural phenomenon around transgender identity?
I wasn't aware of the stats. It wasn't until I started, I was just becoming so confused by this model of care and how this happened and what is the evidence behind this, that I started doing a lot of reading and started reading through the medical literature and articles and just trying to wrap my head around what's going on and what is this? Because I saw this on clinical listserv, especially. There seemed to be this very deep ideological split, but only one side of that ideological split was really being allowed a voice. And I see that split in the trans community. I see that split in the community at large, that there's just very different ideological understandings of what gender dysphoria is and what is best practice. And so that's when I started to read. That's where I found Dr. Littman's study. And it makes sense to me. I do think I was seeing that phenomenon in my practice. I've got 4 teenagers at home. I think I've seen that in their peer groups. And that's not entirely new, that I mean, the spike in numbers and the spike in teenage girls is new. And that sex ratio from mostly natal males transitioning to mostly natal females, that's new. But the part that isn't entirely new is people transitioning for all different kinds of reasons. I don't think that part's new. I think we're just seeing an explosion of one of those types, if that makes sense.
Wait, let me make sure I understand this. So you're saying people have always transitioned for all kinds of reasons, but the part that's new is this rapid onset piece?
I think what's new is just the explosion in numbers of that particular cohort of clients who have been more socially influenced into a trans identity.
Mm-hmm. So how much of this do you think comes from something like social media? I mean, I know you're not a cultural critic, but just as a person in the world, as a professional and as a person in the world, and I do want to get into your own story as a trans man as well, but putting that aside for the moment, what do you think is going on?
Well, I do think social media is a factor. And I mean, my kids are all on social media and TikTok and all of those apps. And I've looked at some of their, we monitor their accounts less as they get older, but certainly, like a year or two ago, we were watching their accounts pretty closely and what they were posting and looking at. And like TikTok accounts, there were some very strange trends that I was seeing with I've got two teenage girls, and there's all these trends on TikTok of teenage girls posting videos of themselves crying or posting videos with all of these like kind of made up. I mean, in the case of my girls, made up sort of different mental health diagnosis, like I've got OCD. Like there are these social media trends.
There's a Tourette's thing too, right? I think that's a big one. Like,
I've just noticed that one as well. I mean, one of our teenage girls, she'd be in her bedroom, like we'd be in the living room, and we see that she's just posted something on TikTok of her like crying and saying, "Oh, all this, and this is happening," and then 5 minutes later, she'd come out of her room like happy, and like it's this weird social
trend. But do they believe it? Is it a performance, or do they really think that they have a mental health issue?
I think it's a performance. In the case of like the daughter I'm talking about, it was absolutely a performance. I mean, none of the stuff that she was posting was true. And like I said, 5 minutes later, after posting that, she'd be out like, and she was fine and laughing and talking to her friends and was fine.
So, what does she say about it? So does she admit that it's performative? Like, what's her narrative? Okay,
she did. Okay. When she was asked about it, it's like, yeah. I mean, she said like, it's just sort of a thing. Like it's almost this irritation. Like, well, this is just normal. This is what all the kids are doing.
Right.
So I think they are to some extent aware that this is just a trend, and they're trying to fit in. It's almost like a competition sometimes, or who can come up with the best stories or who has the worst life. And so teenage trends do happen, and they're strange. And social media, I think, has made things extra strange, more so than when I was a teenager. I'm so glad I didn't grow up with social media and the social, the cyberbullying that happens and things like that. But as far as the gender stuff, I mean, taking what I know from like my teenage daughters and those social media trends and some of the just ridiculous things that they're daring themselves to do, like they're daring kids to self-harm and stuff on some of these social media accounts. And so combining that knowledge with what I was seeing clinically is that I think in the case of my teenage girls, they're aware that there's a performative aspect to that stuff. But you take someone with like autism or ADHD or someone who's psychologically vulnerable in some way, I don't know that they always know that it's performative. I think some kids take these things very literally. And, we were seeing some very lonely kids who struggled to fit into a peer group. And, I've said this in other interviews. I think one of the purposes that this queer theory culture that's developed, it's an orthodoxy, and it has a very strict set of rules. You just sort of learn these certain neopronouns, and you do X, Y, Z, and you get to fit and be a part of this social group. And I think for somebody who struggles socially and has trouble picking up on some of the complexities and nuances of social cues, and are very lonely as teenagers when your developmental task is to fit into a peer group, I have no doubt that some of these kids were kind of saying, well, I can learn these basic sets of principles and words and behaviors and fit into a peer group for the very first time.
Yes. So, okay. So that's so interesting. So this queer theory, it's kind of trickling down. I mean, it starts with something very seemingly complicated and abstract on an academic level. I mean, there's Judith Butler up at the top, right? So if this is like a pyramid scheme, we have Judith Butler at the top, and then, various levels of buy-in, I suppose.
Yeah, it has trickled down, and I've seen that kind of happen over the last 30 years. Like, I studied that stuff in university, and it was like kind of fun at the time, but then I found personally it was making my gender dysphoria worse, and I picked up on that pretty quickly. So it's like fun ideas, but I left them behind. But I've seen culturally these ideas, trickle more and more into the gay and lesbian and trans community. It started as a fairly sort of fringe movement, and now it's completely taken over. And these very, very complex ideas. I mean, I remember reading Judith Butler with a dictionary and a thesaurus beside me. It's hard reading. It's very dense reading, and it took a long time to uncode it and get through the entire book.
Very good for pretending you understand it.
Yeah,
it's made for that.
Yeah, you sort of learn the lingo and recycle it, and
right, exactly.
But the way it's trickled into these very complex ideas have been condensed down into a political movement and very simple messages. And so when they're going into, and first I just want to explain what the purpose of queer theory is. I think that's a really important thing for listeners to understand. The way it was presented to me was, we first learned about Foucault, and Foucault had this theory that we categorize groups of people for the purpose of oppressing them. So his argument was, and I think this comes from his book, The History of Sexuality, that his argument was that the idea of a homosexual person was an invention. Before that, there were behaviors, but the idea of a homosexual person and a homosexual group of people was an invention for the purpose of oppressing that group of people, according to Foucault. So people like Judith Butler took those ideas, and the whole idea is, okay, so if that's true, that by delineating and clearly identifying a gay and lesbian people for the purpose of oppression, if that is true, then the whole queer theory project is to create this kind of smoke and mirrors show in order to blur the boundaries around what it means to be gay or lesbian or male or female, so that we can no longer be delineated as a clear group of people. So when you talk about queering a culture, that's what we're talking about. We're talking about confusing the boundaries between things like gay or straight and male and female, so that we can't clearly point at any one group of people and say, we're going to oppress you.
Oh, so it's doing away with categories, because from the outside, it looks like a fixation on categories.
It really does. I know. But the original purpose of it was to queer these ideas of categories. It's meant to be destabilizing and to confuse categories. So it'll never end. As soon as we create new categories, they're going to queer those again. So it'll be this like perpetual, and we're seeing this play out. It's this perpetual destabilization of categories, because fundamentally it's based on the belief that there's only two groups of people. There's only oppressors and the oppressed. And the only way the oppressed can escape oppression is to constantly blur boundaries.
Okay. So, right. Like a moving target. Like if you're a moving target.
Exactly. If you're a moving target, if you're always wearing camo, right, then you're not going to be oppressed. But we've taken these ideas. I don't really believe it. I think it's a very pessimistic way of interacting with human beings, to always be on guard for who's going to oppress me. So, we could dissect that all we want. I definitely have criticisms of the theory, but we've packaged that down into a very simple politic, and going into schools, presenting this stuff like the gender spectrum as fact, as this is just material reality and science. It's presented as this is somehow scientific and this is how the world works. these kids are picking up queer theory, not really understanding where it comes from and what its original purpose was.
Yeah. And it's so, people ask me why I'm so fascinated / obsessed. People accuse me of being obsessed with this topic. It really is this capture. Like, how is it that this phenomenon that you just described has been embraced by, like, quote unquote, regular people, regular elementary school teachers, regular social workers, people who go to get PhDs in education? How did the institutions come to be so captured by this really weird and complicated set of ideas?
I'm as baffled by that as anybody, like how quickly it seems to have captured institutions. Like even in the last few years, it seems to have completely taken over at really high levels of government and, the UN. And it is such a strange set of ideas. I mean, and there are new organizations like FAIR, for example, that are human rights based organizations, but pushing back on some of the critical theory. So, and that's a misinterpret. Some people interpret when you criticize queer theory that they equate that with being transphobic or homophobic. And I don't think I as a trans, because I'm not denying that homophobia actually exists. I'm not denying that true transphobia exists. It doesn't exist everywhere people see it, but I do think that it's not that I don't think that oppression happens. I just don't think that queer theory is an effective or appropriate response to true oppression, and I don't think it's actually liberating us. I think it's actually doing the opposite. It's dividing people. It's attempting to control our thinking. I don't feel free as a trans man to think for myself and have the politics of my choice, because I feel like this theory is being imposed on me, because now it's being institutionalized to the degree that it's defining what it means to be trans in ways that are imposing queer theory onto me. And I found queer theory, when I studied it, I found it to increase my gender dysphoria, not decrease it. So I'm very concerned about, even on a personal level, the imposition of these theories onto me as a trans man.
Yeah. Well, I want to hear about how it increased your gender dysphoria. But actually, before we get to that, it seems to me that a lot of the capture is the result of well-intended people being so afraid of repeating the same mistakes we made during the gay rights movement with conversion therapy and, just homophobia pretty much across the board in mainstream culture. People have a hard time separating being gay from being trans. It's all going under the same umbrella, and it's really two entirely different things.
It is. It's a political strategy that we should be free to reject or accept. And I personally have rejected it, but we've tied these theories so much into the queer or gay or lesbian or trans identity that we've gotten to a place where we can't critique the theory without being accused of bigotry. And that's, I really would like to see the
brilliant strategy on their part. That's like bulletproof.
Yeah. Yeah. I mean, young people, when young people identify as trans, I think they're the ones impacted the most by this, because we're not teaching about gender dysphoria anymore. We're teaching about queer theory, and we've completely have now defined trans according to queer theory. So I'm really concerned about these young people moving forward, because every political movement has an end. Like, that's just historically, there's never been a political philosophy or movement that has remained dominant forever. And when these young people have constructed their entire sense of self on the foundation of queer theory, and people start to critique that and see that it's not working and it's doing harm in some ways, these people truly do feel attacked. They would truly do feel like their identities and the whole ground is falling out from under them. And I think that's why we see so much, psychological instability and emotional upset as we have these public conversations.
We're going to pause here for a short message from me. Are you appreciating this conversation and wishing there were more like it out there? Well, there are lots more right here almost 70 of them by now. I do this show every week, and I pretty much do it all by myself. That is why, as much as I'm loath to ask for help, people who know me know this, I am offering this gentle reminder that if you value honest, thoughtful, nuanced conversations with all kinds of people, novelists, scientists, philosophers, comedians, journalists, sometimes even just regular folks with something interesting to say, I hope you'll consider supporting the show in any way you can. One way to do this is by joining our Patreon community at patreon.com/theunspeakable. You can join for as little as $5 a month. That gives you early and ad-free access to the show, or for as much as $100 a month. And yes, people have done that. There are lots of perks at every level, including if you join at the $10 a month tier or higher, the chance to join our bi-weekly hangout, where we, and that includes me, get together on Zoom to talk about a recent specific episode of the show. Joining at that level also gets you discounts on your first purchase of official Unspeakable podcast Nuanced AF merchandise. If Patreon is not your thing, you can also make a one-time donation in any amount by going to the podcast's webpage at theunspeakablepodcast.com and clicking the donation button. This podcast is a one-woman enterprise. I'm not affiliated with any institution, media company, secret investment cabal, or anything like that. I do it because I love it. And if you love it, or even like it, I hope you'll consider supporting it in any way that makes sense for you. Leaving a positive rating or review wherever you get your podcasts is a big help, actually. And telling people about the podcast, sharing it with friends, just spreading the word actually means more to me than anything. So thank you for listening to the show, for making the unspeakable worth speaking. And with that, back to the interview. So when you say that queer theory made your gender dysphoria worse, what do you mean by that?
Well, first to explain what the experience of gender dysphoria was like for me. I mean, I've had an experience of gender dysphoria for as long as I can remember. And I had no framework in which to understand that. I really did believe as a child that I was a boy in some way. And I now call that an error in cognitive categorization, which is mostly an unconscious process. And it tends to start when we're about 2 or 3. So I think that for me, that explains why I had this experience of gender dysphoria from that age. So when we think of cognitive categorization, it's an unconscious process in which we just make sense of our world by placing things into categories, like cats and dogs, for example. Like there's lots of similarities between cats and dogs. They're both mammals. They both have 4 legs. They both have hair. But a 3-year-old can point to a cat and point to a dog. And I don't think it's because they sat down, with a spreadsheet and figured out, okay, what are all the differences? And, they figure it out, right? Based on what they're seeing and hearing, they make different noises and their faces are kind of shaped differently. And sometimes they'll see maybe a dog that might puzzle them for a minute. And it's like, well, what is that? Is that a cat? So a
dog can be smaller than a cat.
Absolutely.
It's possible. It's not the norm.
So it's quite sophisticated. Yeah.
Right.
It's a very sophisticated cognitive process that happens when you kind of think of it, but a 3-year-old can do it. And so a 3-year-old is going to look at boys and look at girls and try to figure out the difference between the two. And it is based on stereotypes. And, the feminists will point to this a lot that, gender dysphoria is all based on sexist stereotypes. Well, cognitive categorization is based on stereotypes. It is based on just taking information and sorting it into categories. So if all the boys in our lives have short hair and all the girls in our lives have long hair, we're going to categorize, okay, if you got short hair, you're a boy. If you have long hair, you're a girl. And of course, it's more sophisticated than that. We're constantly taking in new information. Okay, boys, do X, Y, and Z. Girls do X, Y, and Z. So a 3-year-old can, for the most part, can point at a boy and point at a girl or a man or a woman with accuracy. But it's not uncommon for little kids to walk up to someone and say, "Are you a boy or a girl?" And it's not meant to be mean. It's something about that person isn't fitting with their cognitive categorizations. And so they're constantly integrating new information into these categories. And so for whatever reason, as a child, I had enough characteristics that I was seeing in boys, and unconsciously, I think I just categorized myself as a boy. And that idea, normally, my understanding is that it's not uncommon for gay and lesbian people to experience that to some extent because of their sexual orientation, that as a young child, you're not going to understand yet. And for the vast majority of children with gender dysphoria, as they integrate more complex information into their categorization system, and then their actual sexuality wakes up, most of those kids do resolve it through puberty and just become gay or lesbian people. A lot of gay and lesbian people would tell you that they had some degree of cross-sex identification as children. They might have been girly boys and wore their mom's dresses or high-heeled shoes as children, and now they're just happy gay men who may or may not be gender nonconforming as a gay man. For some reason, for very few of us, that doesn't resolve. Even though I integrated more complex information, I'm not delusional about what biological sex is. I mean, I understand the concept of gametes. I understand the concept of genetics. But that for whatever reason, none of that corrected my own categorization of self as male. And so that distress as I got older and older and older became greater and greater and greater. And I really tried to resolve that for myself through just a cognitive process of thinking it through and thinking, well, no, I mean, I must be female because I've got this, body part. Right? So I did try to break it all down and resolve it. But what complicated it for me at age 19, I was starting to be involved in the gay and lesbian community. And my dysphoria at that point, as I was developing a lesbian identity, did start to get better. But then at 19, it was discovered that I had a very rare intersex condition called an ovotesticular DSD. So I had surgery for a large cyst on what they thought was an ovary. And when they went in to remove the cyst, the surgeon said, well, the ovary wasn't recognizable as an organ, and it was so damaged and engulfed in this cyst that they just had to remove all of it. And they did a biopsy and discovered that it was an ovotestes. To what extent it was an ovary versus a testicle, I don't really know. But so.
Wow. How did you feel? Were you upset? Were you relieved? Was it a revelation?
It was a mixed bag of feelings for me, because on one hand, it validated, okay, because I thought, okay, so maybe that's why I always just felt and seemed more masculine. And none of that was a performance. I mean, my entire life, everyone said, like, you look like a boy, you act like a boy, you talk like a boy. A lot of people thought I just was a boy when I was a really little kid. I would have kids coming up to me on the playground saying, hey, I heard you're a girl, but how do you do that? How do you look so much like a boy? And so it was very obvious to everyone around me that I was just in some way more boyish. And I did have, some facial hair and, very androgynous sort of appearance. I wasn't very, as a young adult, wasn't hyper masculine appearing. Still had this ongoing gender dysphoria. And so when I discovered that I had this rare DSD, and on one hand, it validated some of that for me. It's like, okay, maybe this is somehow related to this feeling that I always had. But at the same time, started to just confuse me more about, well, what does this mean in terms of my biological sex? And so and the doctor wasn't terribly helpful at the time. I mean, he wasn't a DSD specialist. He was just a gynecologist. And he seemed kind of embarrassed for me. I mean, he told me about it. He said, this is what we found. But he just kind of brushed it under the rug and sort of said, well, I mean, it's gone now. We removed it because it is a cancer
They cured
risk.
it. Yes.
Yeah. So it's like, don't worry about it. We removed it. He sort of seemed embarrassed about me. So he seemed to be just more trying to reassure me that, it's okay. You're still, you're healthy, and we removed it. And so just forget about it. And so that I picked up on that cue that, this is something to be embarrassed about. So I didn't even tell anyone about it. And I believed him that it's gone, so I don't need to worry about it. And he didn't know that I had gender dysphoria, and so no further medical investigation was done about it. And I tried to just not think about it. But in the back of my mind, I was still really confused about what that meant in terms of my biological sex and how that related to just this sense of self that I had as male. And when I started reading queer theory as a young adult, so that would have been about 1993, roughly.
Exactly, right. The sweet spot of that.
Yeah, the very beginnings.
Movement.
Yeah, yes. So Judith Butler's book had just been published. And so I read that stuff. And initially it appealed to me because when Judith Butler was talking about things like, or Judith Halberstam is another one of the writers, sometimes goes by Jack Halberstam. They were writing a lot about about female masculinities. And I think that's when I first heard the term transgender as well, and genderqueer. So they were wrapping these identities up at that time into this queering project. But when I first read it, I thought, well, they're talking about this feeling that I have. But it quickly became apparent to me, that those theories were making that confusion I was having about, well, what sex am I? Because the whole project of queer theory is to destabilize and confuse our notions of those things. It wasn't helpful for me to try to land on what does this actually mean for me in terms of my DSD? What does this actually mean for me in terms of my biological sex? To put on top of that confusion a theory that is intentionally trying to disrupt your notion of what biological sex even is.
Wow. Okay. So at what point did you start thinking about transitioning? And when you say you had never heard the term transgender, I'm assuming you had the term of art was transsexual. That's what people called,
I didn't even really know about transsexuals.
Oh, yeah, really?
I didn't even know. None of that was really on my radar. Because I grew up in a very tiny farming community. I was pretty sheltered as a kid. So even the idea of the gay and lesbian community was a fairly new thing for me. And I met a lot of very masculine women in the lesbian community. And that's initially how I was making sense of all of this, was maybe this is just something that some gay and lesbian people, feel and experience. And some of those women were physically more masculine appearing than I was. That's how I started to make sense of it. And I had never heard of anyone getting a sex change, to use that old language, or that there were transsexuals or any of that. So in the cities that I was living in at the time, that really wasn't happening yet. And when queer theory became popular, there was a new movement of drag kings. That's something that popped up, was women, performing masculinity on stage. And I saw that very much as being a part of this queer theory movement and female masculinity. And it was fun and playful and performative. But it wasn't until I moved to Vancouver, which I realize now is kind of a hot spot for some of these ideas. Queer theory is really popular on the West Coast. I had been living on the East Coast prior to moving to Vancouver. And that's when I first met a transgender person for the first time. But it was a number of years before I considered the possibility of transitioning. It didn't even really cross my mind. I still struggled with gender dysphoria, still felt more masculine, whatever that means.
And when you say struggled, what do you mean by that? Because it sounds like you were a pretty self-possessed person. You weren't, the way you're describing this, you're not obsessed with yourself. You're not obsessed with your struggle or your gender. So what would be an example of something where it would feel sort of acutely painful or uncomfortable to be dealing with this?
Initially, as a kid, it wasn't about my body at all. It didn't start as, people say gender dysphoria is body dysmorphia. It didn't start out that way for me. It really was just a cognitive process of I'm categorizing myself as male. It had absolutely nothing to do with body parts. I mean, I never saw little kids running around naked as a 3-year-old anyway. So it's not like I was looking at boys thinking, well, they've got penises and I don't. And I had fairly ambiguous genitalia probably because of the DSD, because my testosterone levels would have been high, right from fetal development onward. So it wasn't based on that kind of rational reproductive categories. It was just, I just seemed to naturally fit in with the boys more easily. And so it was more about just how I wanted to be in the world and where I just felt most myself and the most comfortable is how it started. It didn't become about my body until probably starting in adolescence. And then that part intensified because at that point, as a little kid, it doesn't really matter what sex you are. I mean, kids just play with everybody. And
well, especially back then. I don't know about now, but yes, back in our time.
Back in our time, I mean, I had tons of friends with both boys and girls.
But this was before the Disney princess phase changed everything. Yes.
Yeah. And it became more about my body because once we became teenagers and everyone just now boys are looking at girls as dating material, not as friends, right? So the whole social dynamic changes when you're adolescents and into adulthood in ways where I felt like, well, I just don't know where I fit in anymore then, because I was same-sex attracted, still felt more like I fit in with the boys, but they're all acting weird towards me now. And so it was a very confusing time. And that's when it became more about my body, because I blamed my body for not fitting into the world anymore in a way that I could just be myself. And so that started a spiral of, well, now what do I do? Like, I went through phases where I tried to appear more feminine just to fit in, but that just it just wasn't me. It just didn't feel authentic. I just wanted to wear the clothes I wanted to wear and be myself. And so I tried different things, but the distress of not fitting in and being really confused about my biological sex just got worse and worse and worse. And then so along with that, the distress about just my body got worse and worse and worse. And so when I would say that it was difficult because that cognitive spiral of trying to figure it out never ended. And that's really hard to describe to anyone that hasn't experienced it. It's because I knew that I didn't know how to call it. I didn't have a name for it. I didn't know about gender dysphoria. So I had no word to describe it. I had no framework in which to understand it. And I kept trying to almost obsessively try to figure out, well, what sex am I? What sex am I? What criteria am I supposed to use to determine that? And so that just became kind of crazy making after a while. And then I started hanging around a little bit with the butch femme lesbian scene, where people were just recognizing my masculinity and were calling me boy or calling me butch. And that served a purpose for me. That felt comfortable. It felt good to be just recognized for and valued for my innate masculinity. But it started to intensify. So it felt okay within that cultural bubble, but then that it would intensify my discomfort outside of that bubble. You know, if you go to work and now you're called she again, like, it's not that anyone in the lesbian community, when they call the butches boys or he or have male pronouns or have male nicknames for them, I mean, everyone understands that that's a shorthand. It's a cultural nod to their masculinity. It's not a literal you are male, but it felt comfortable for me inside those circles. But the more I was being called he, boy, by male names, that contrast of that feeling better for me and then going out in the world where other people weren't referring to me by male pronouns and names, that started to feel more uncomfortable for me. And then at that time, there were a number of different things going on in my life at that time, like the birth of my daughter, the breakdown of my long-term relationship. I went through a major career change, and a gay man was murdered in Vancouver at that time as well, which was he lived 2 blocks away from me, and it was heartbreaking and very distressing for the entire gay and lesbian community in Vancouver at that time. And all of that weighing on me, I wasn't in my best frame of mind. And I was in my living room with my girlfriend at the time, watching a documentary on TV about trans kids. And their interviews with the kids sounded so much like my experience of gender dysphoria and back then it was called gender identity disorder, but I don't think they even called it that in the documentary. I think they were just talking about trans kids. but their experience was so similar to mine that I thought, oh, well, now that's it. Like that's my experience. And they're saying that when you experience this, that means that you are a trans person. And I thought, oh, well, then I guess I'm not actually a lesbian after all. I guess this isn't about masculine or feminine or masculine femaleness. This is, because they're describing the experience, and this is definitely my experience. And so they're saying on mainstream television that when you have these feelings, it means you are a trans person as a completely separate category of personhood. And so it completely flipped my identity almost instantly. And
Wow.
I started to buy into this idea that, okay, now I have this answer. And I started reading a little bit about it, read Jamieson Green's book about his journey and realization that he was, trans man.
And did you say anything to your girlfriend in that moment on the couch?
I did. I just kind of said, that's me. And she said, I know. And so she seemed to validate it, and more butch lesbians in the community were starting to transition at that time. And some of the butches were saying like that, like there was a photographer a butch lesbian photographer in Vancouver who did a whole show about gender identity disorder. And so that was getting discussed a little more in the community. So it just seemed to sort of presented to butches at that time, and probably still, that here's your two options. You can be a butch lesbian and have this condition, or you can transition and have this condition. And it seemed to be presented that when you changed your body in transition, that it offered you relief from the dysphoria. And so that was my motivation for doing it, was to try to just stop that cognitive dissonance that I was constantly struggling with.
What was the assessment process like for you?
It was the beginnings of what we call the affirmation model. It was...
And what year was this? This would be like the mid-2000s or so?
Yeah, it would have been about, I think, 2006 when I started the whole process.
Okay.
So there was an assessment process. I was assessed over a period of several months. I don't remember. It's a bit of a blur for me now. But we did talk about just my childhood experiences of gender dysphoria and what my goals were for transitioning. And we did talk about some of the risks. And I think that's all I really remember about the assessment process.
Do you know how long it went on for? Are we talking months? Like
it was about 2 or 3 months, I think.
Okay.
Is what I remember. So it might have been like around like maybe 6 visits. I may not have all of the details exactly right, but it was something like that. It was several visits over several months, at least a couple of months, for testosterone. But before I had any surgery, I had to go see a psychologist for a separate assessment, just sort of general mental health. And I remember filling out a bunch of sort of screeners, and so I wasn't diagnosed with anything other than gender identity disorder and depression. And we all felt that the depression was as a result of the gender dysphoria.
Did the transition help the depression?
It did. It definitely helped with. It helped with some things, and it complicates things in other ways. I mean, it did help with just that constant rumination of, am I male, am I female? It just makes me feel more like I can just be myself. And because as a masculine appearing female, I definitely, every time it caused me a lot of anxiety going out in public, because there weren't many times where I could go out in public where someone makes, some sort of homophobic comment, or, guys screaming out of their car windows, fucking dyke or whatever. Like, it weighs on a person. And so I do feel some relief that I do feel more comfortable in my own skin. And it helped me to just kind of relax and settle into myself. But that's also not without a lot of work to do that and continue to work on my mental health. And so it helped with some things, but I mean, I know that I'm not confused about what biological sex is. So it doesn't completely eliminate that rumination. Like I still wonder, like, what does my DSD mean in the whole bigger picture of what is my biological sex and is that related to gender dysphoria. And I've just become really curious as a person and as a clinician of just wondering, well, what is gender dysphoria? Because everyone has their own sort of pet theory about what is it. People say, well, it's trauma, or it's OCD, or it's body dysmorphia, or it's paraphilia. Everyone has their own sort of pet theory about it, including trans people, because trans people have to have some sort of narrative to hang their hat on and just get on with their lives. And there's a lot of infighting in the trans community about what is this experience and how do we define it and understand it. And it's so divisive, both inside and outside the trans community and inside the clinical community and the community at large. I really want the clinical community to take a stand on this and look at the evidence and give us the best. What is the best evidence, and what does the best evidence say gender dysphoria is? I really feel like I think we've made a huge mistake turning this all into queer theory as a queer theory movement rather than a science-based medical understanding of gender dysphoria, because not everyone is ever going to agree with queer theory. And so
no, really, it's so easily mainstreamed.
It seems like we've built this whole castle onto sand, right? Whereas I know people they say, well, we don't want to pathologize this, we don't want to stigmatize it, but there's lots of conditions out there, and our goal is to educate and destigmatize certain conditions, not completely deny that the condition exists. And so I'm just curious. I think it would do all of us a lot of good if we could just land on what do we know about this? What is it as a clinical condition, and not define it according to any political movement or ideology.
And what do we know? What studies are out there? Because another thing that happens is there are so many different studies floating around, and you can, no matter what quote unquote side you're on, you can cherry pick your way through them. And some of them have tiny sample groups and they rely on self-reporting and all this stuff. So what sort of data set do you believe or rely on?
It is really confusing because there are so many studies. There's a lot of poorly designed studies, and there's some, well-designed studies and very contradictory information. So it is difficult. I do think, so in terms of different ways that they've looked at this, they've tried genetic studies. They've tried brain scan studies. They've done like twin studies looking for genetics, and then of course if you go back to the work of went back before queer theory took over, this was mostly the field of psychologists. And so when I looked back through the research, I went back to like the 80s when Blanchard and Zucker and others were studying this from a psychological point of view, and having looked at all of it, and I'm willing to change my mind as new information comes up, and I would really like to press on WPATH and other organizations to really review the literature and nail this down. But I do think, looking back through it, that our strongest evidence to date that makes the most sense to my experience and others that I've kind of witnessed in the community and community dynamics, I think Blanchard's typology thus far is the best we've got. I don't think it's perfect, and I don't think it's complete, but I think it's the best we have as far as the quality of studies. And I think some of the medical studies since then support his typology. And we have to be
what
really
is his typology?
So his typology is that they were seeing back in the 80s in the clinic in Ontario, they were seeing primarily two types of people showing up wanting to do the sex change. So it was young boys with gender dysphoria who had, sounds like the kind of gender dysphoria I had, that started at a very young age and was sort of persistent and consistent throughout life. So it was those boys being brought to clinics by their parents and middle-aged men. And one of the trends that they noticed was that when they did cohort studies on the childhood onset type of gender dysphoria, and I think there's something like 7 studies about this now, their stats are a little bit different, but the conclusions are all the same, that when you follow those little kids with gender dysphoria through childhood and you just support them and love them and not really intervene, that most of those kids through puberty they use the word desist. So that sense of cross-sex identification just kind of sheds off. And most of those kids turn out to be gay or lesbian. So it was those kids being brought to clinics. And that's why they had a sort of a just love them, support them and see what happens approach with those kids, knowing that most of them are going to figure it out and sort it out. And the small percentage of those that didn't outgrow it and it wasn't really responding to any kind of psychotherapy, and if it was distressing enough, some of those were the ones that were medically transitioning as a palliative solution to their distress. The other cohort of middle-aged men that were showing up to clinics were primarily heterosexual or bisexual men. And so the typology is that those are 2 completely different phenomenon and 2 completely different developmental pathways. So one being more connected to a homosexual sexual orientation, and that gender dysphoria is somehow part of the psychological developmental aspects of a gay or lesbian identity that normally that sheds off. And then the other being what Blanchard described as autogynephilia, which is a paraphilia in which a heterosexual orientation inverts onto itself, where because male sexuality is a lot more target-based, more so than female sexuality. Females tend to be more relational. Male sexuality, in terms of just how their sexual orientation seems to be wired, is they're very target-based. And so the target can be displaced rather than on, heterosexual males having erotic targets of females, that sometimes that gets displaced, and that's what's called a paraphilia. And that could be placed on anything. I mean, you hear about shoe fetishes or...
Oh, so that's what paraphilia right? means. I was going to ask you that.
Yeah,
because,
so that's what paraphilia means. It means that the erotic target...
You can be attracted to anything. So okay. I mean,
and I've heard a theory that, and I hope this is true, but this is what I've heard, is that for every kind of target, like a paraphilia, that there can be like an auto meaning self, so it can turn on self. So if for because heterosexual target is, my sexual attraction is females, that target can be reversed and inverted into I'm attracted to the idea of myself as female. So I've heard this about other paraphilias as well, like someone who, like in theory, who has like say a fetish for shoes, they could in theory have an auto, whatever that's called, fetish for shoes, where they eroticize themselves as a shoe and would want to dress up as a shoe. So so if that kind of makes sense, how
is this the furry? Is this how we end up with furries as a cohort? Not to derail this conversation, but is the furry thing considered a paraphilia?
I don't know if that's officially considered a paraphilia or if that's an inversion on, I don't know, that's dark territory.
Sorry, we don't get to...
Is that bestiality, inverted to self? I don't know. I think it's probably more fun and playful than that. But
yeah, this is like a cosplay kind of thing. Yeah. Just anyway, yes. Okay, go ahead.
The 2-part typology, that was primarily who they were seeing coming to clinics, and that has become very... Blanchard has become a swear word in the trans community.
Autogynephilia is verboten as a term.
Yes, we're not supposed to talk about that, but I feel like the homosexual subtype of gender dysphoria that he talked about completely is like, it hits the nail on the head as far as my experience. So my frustration with dumping the whole typology, just because, I mean, I understand the people with AGP, I understand conceptually why they wouldn't want that widely known in the public. It's not great PR. It's much better PR to just brand this all as trans and bold and beautiful. So I get that, but by dumping the whole typology out, they've also denied me the opportunity to understand the gender dysphoria that I experienced. Nobody sat me down, when I was going through this saying, hey, did you know that there's this type of gender dysphoria that tends to only happen in gay and lesbian people, that a lot of gay and lesbian people feel it, especially as children, and most outgrow it. And providing me with that education actually would have been helpful for that cognitive process that I was struggling with, to just sort out why am I experiencing it.
Been helpful to you when you actually transitioned because you were an adult?
It still would have provided me information in which to make sense of my experience, even if I decided to transition or not transition. And I do question, if I had been given accurate evidence-based information to understand my experience, would I have felt the same drive to transition? I don't know. I mean, it's hard to say in hindsight, but I think it's possible that what I needed was just, because a lot of that cognitive dissonance that I felt I continued to experience because I still didn't understand my experience. So it made me more comfortable in my skin, but I still struggled, and I conceptually with just trying to understand, what is this? Why on earth would someone think this and experience this? So the typology made sense to me, and it just gave me somewhere to land in understanding why I felt this. And I do worry how many kids out there or young people out there think that they're trans because they had this childhood gender dysphoria, and nobody is telling them, well, wait and see, right? Because this is what we know about this type of gender dysphoria, and it might, odds are that this means that you're gay or lesbian. Nobody's teaching these kids. I mean, maybe somebody is, but in the informed consent model, that isn't the information that's being taught to people. And I do think just that information alone could change the trajectory of what someone chooses to do.
And is this coming out of homophobia? I mean, it's just remarkable that the gay rights movement has gotten as far as it has. I mean, it's completely mainstreamed. We don't, often we don't even think about it. But yet there would be a stigma against suggesting to a kid that they might be gay. It's better to be trans than gay. That's
certainly a fear that I'm hearing from the gay and lesbian community. I mean, and even with my family, I have a good relationship with my family now, but there was a time, when I was, identified as a lesbian and a butch lesbian, that my parents and my community, I did experience quite a bit of homophobia there. So one of the first things that my dad said to me when I told him that I wanted to transition was, well, that makes a lot more sense than the gay thing. I don't know why you don't all do that. So if people think that, we live in North America, we have freedoms that other countries don't have, we don't want to think of ourselves as being like Iran, where we're converting all our gay people. But we are to some extent. And I'm not saying that all trans people are just secretly gay people, but due to misinformation and then add that layer of individual families or individual communities that don't feel comfortable with butch lesbians or very highly effeminate gay men. Even the gay and lesbian community isn't always very warm and fuzzy towards, especially really effeminate gay men. I think it's a mistake to think that consciously or unconsciously, a lot of things happen at an unconscious level, that some people, it's like, if someone is so effeminate that they can't find anyone to date, because a lot of gay men don't want to date really effeminate gay men. They're getting bullied. They're afraid for their lives in some cases. They're not fitting in socially. I can totally understand why it might be easier for some people to transition and find some peace in that. And we're mistaking ourselves if we're thinking that homophobia doesn't exist, like it does in Iran, in some communities and families.
Would you call yourself an activist? Are you a different kind of trans activist?
I'm a different kind of trans activist. Because I feel disturbed what's happening, especially it started as a concern what's happening in the clinical world. I just feel like the clinical community has become very captured by queer theory, and I think that's a mistake, and I think it's doing harm. And it becomes very hard to even interpret a lot of the scientific data when you have that mindset. So, for example, if we were to do MRI studies on trans people to try to find this holy grail of some biomarker for gender dysphoria, if we don't believe in the typology and we think that a trans person is just a trans person like any other trans persons, and that it all has the same developmental pathway and the same origin or same cause. So we're going to line up a bunch of trans people. Let's say we line up 100 trans people and scan their brains. I don't know how meaningful that data is going to be. If the typology, if Blanchard's typology is correct, that AGP and homosexual transsexualism are two completely separate things that only converge on the point of I want to change my body. But psychologically, they're two completely different things. You can't lump them all together and scan their brains to find a biomarker. So I just feel like in the last 30 years, so much of our data to try to understand this condition is junk science because we aren't asking the right questions, and we're not controlling for sexual orientation in a lot of those studies.
Do you have a lot of young people come into the clinic, or did you when you were working there, with data in hand, studies in hand that they have found that they believe proves to you and to themselves who they are?
Not usually. Some of them had done, a bit of online searching and found, because all this information is kind of public now, right? Because of internet. So some of them would be familiar with some of the brain scan studies or the genetic studies. And
there's a lot of, because what you hear a lot of, like if you try to, cite Blanchard and Bailey, et cetera, you hear a lot of people say, well, according to this other thing that I read in Pink News or whatever it is, you're totally wrong. And this proves that you're wrong. Like, what do you do with that?
It's hard, because a lot of people have just completely dismissed Blanchard and Zucker just because they've heard in the community that they're bad, without necessarily knowing all the history or without actually looking at their work and really understanding it, have just dismissed them because the community has dismissed them. And so I had heard of Blanchard and Zucker years ago, wasn't really familiar with their work, but heard their names cast in a very negative light and hadn't really looked at their work with an open mind. And I'm glad that I did, and I wish I had sooner.
So you have started an organization. How organized are you around this, or are you just kind of mostly out there talking at this point? We
collected some people as we go. I'm certainly not alone in the community as far as rejecting the what's now called gender ideology, the queer theory based understanding of gender dysphoria. A lot of us have never bought into that, or others did, but are now realizing the harms. So those tends to be the people that come to us and reach out to us saying, thank you for doing this. You're providing our half of the community with a voice to just want to look at the science and to not deny biology. A lot of us are kind of have been watching in horror some of the politics play out and how there are different warring factions, like the queer theorists battling with radical feminists and these very ideological battles that are playing out and then really hard conversations like what do we do with sports and same-sex
I know. I was going to ask you, do you have a solution?
I don't have a solution, but I think when we don't have a queer theory way of thinking about this, most people in my circles would call themselves, the homosexual transsexuals who completely understand their biology and understand that biology is relevant. And it's not relevant when I go and buy a loaf of bread, but it's relevant in regards to my medical health. It matters as far as like what goes on our medical records, so that if there was an emergency, that our care providers know what our biology is. So, and I understand, biology does matter in terms of physical abilities, like sports. So there are a lot of us that are willing to just have reality-based conversations about these things and try to find fair solutions.
Yeah. It seems like this word community is becoming a misnomer. There's going to be two communities, at least.
There always has been. There's always been two very different camps within the trans community and the clinical community is what I'm realizing. These two very ideologically different groups, and we just don't interact much. So I think that's why I've been so oblivious to a lot of this, because I've just been off doing my own thing, and I've got my own little circle of friends that think similarly as I do. And I was kind of oblivious to how much queer theory is taken over and how much is driving a lot of hostility towards the trans community and towards the gay and lesbian community as well.
So you have a group called Gender Dysphoria Alliance. What are your goals there?
Our goals are primarily to educate. We've been wanting to just provide our part of the community a voice, because it seems like those with the loudest voice in the trans community are those that come from the queer theory perspective. And we felt, because a lot of us on the other side haven't been as politically active, we feel like our voice just hasn't been heard in the whole debate. And so we wanted there to be, it serves different purposes. So one is we just want people to feel like there's some place that they can go if they want to tell their story. And so we tell stories in a few different ways. We do have a blog. So if people would prefer to just write their story out, we'll publish it. And just get it out there. And we also have a podcast called Transparency, where we just have opened up the dialogue. They're fairly informal conversations. The original concept was, as friends, we have certain conversations, around a campfire or the kitchen table that look quite different sound quite different from what's being talked about in the public sphere about everything trans. And so our original concept for Transparency was, let's just get together and have those conversations recorded, and we'll just put them out there so that people hear a different kind of trans conversation. And then we do sometimes invite people in. So we've talked to, like Dr. Littman and Dr. Blanchard, and just to have very non-confrontational, nuanced, heterodox conversations on the topic. And so we have been growing pretty quickly. We've had quite a few trans people reach out to us saying, yes, I feel the same way, and I'm really concerned about the direction the politics have gone in, and the amount of hostility that it's generating and how divisive it's been. And then we do want to branch out. So we tried to provide our best interpretation of the evidence as far as what gender dysphoria is. And our next project and goal is to create some other educational materials, like series of short videos and printed materials. So we still have room to grow as far as the educational piece. And then the other side of what we do is advocacy and lobbying. So we have done some lobbying government agencies on things like certain bills that are being passed, like conversion therapy bans, for example. We just want to make sure that those bills are worded in such a way that it's not interfering with ethical exploratory psychotherapy for gender dysphoria.
Mm-hmm. Oh yeah. Well, that's a whole other. Yeah, that's a topic.
That could be a whole other
really
podcast.
Exploring. Yeah, no, I think that's really important. Actually, it's kind of like these CRT battles. It's like, well, no, you don't really want to legislate that at that level. Anyway, all right. This is my last question, and it's probably unanswerable, and it's incredibly reductive. But what percentage of the population do you think is trans?
That is hard to say. Part of why it's hard to say is because when we say trans, I don't think we're always talking about gender dysphoria. I think, when we're looking at a percentage of the population that has a type of gender dysphoria, I think it's a very tiny. But when we call it trans and have politicized it and promoted it as we have, I think those numbers are starting to inflate artificially, because lots of people say they're trans who don't have gender dysphoria.
They're saying it for political reasons, or just
if whatever their motivation is. But even clinical bodies and organizations are saying that gender dysphoria isn't necessary to be trans and isn't necessary to medicalize. So I don't know what trans even means at this point.
Okay, so what percentage? Back when we called this transsexual, what percentage was it, do you think? Like 0.01, like 1%, less than 1%? Just really like, what's your instinct? Obviously, this is not going to hold you to
best guess
this.
is probably like 1% would be my best guess. But I think that I saw a survey recently where they surveyed, I can't remember if it was like high school students. It was school-age minors anyway. And I think they said something like 23% were now saying that they identified as some type of, like, under the trans umbrella, whether non-binary or demisexual, or so. I mean, those numbers, because trans is now a political entity. It's not a cultural entity. It's no longer about you have a clinical condition and you seek treatment for that condition. I think that percentage of those with a clinical condition is very tiny, but we've marketed everything queer and trans in such a way that it's become very attractive to people, and heterosexuals can now opt into under the queer umbrella by saying, well, I'm a demisexual, or I'm whatever neopronoun they want to assign. So I don't even know how we now measure any of these numbers of how many trans people there are.
Right. Although I guess unless we're talking about medicalization, does it really matter? Like, what's the damage?
Well, yeah, that's a good question. I mean, as far as political movements go, I guess every generation has had its political movements. The mods and the punks and the hippies, and so I could be argued, I guess, that how is this any different than that? Except that I don't remember, the punks or the mods or the hippies having ideologically captured our institutions and governments to this
yes,
extent.
there was back when the ACLU was captured by Goths. Yes, that was a strange moment in time.
I don't know if you're familiar with just on, perhaps a final note is I don't know if you've read the WPATH Standards of Care version 8 that has been released as a draft for public input. It's open until the 16th for public input. They now include a chapter on eunuch identifying people, or eunuch dysphoria.
Oh, yeah, I saw something about this. Mm-hmm.
So It just seems to be that the trans umbrella is collecting people as it goes.
Right. Wow. Well, certainly this podcast is collecting trans-related episodes, for better or for worse. Well, this has been outstanding, Aaron. Thank you so much. You're incredibly insightful and articulate, and really just incredibly sharp on this topic. So I'm very, very grateful.
Well, thank you. I was grateful for the opportunity to just have a chat with you and talk about this stuff and just open up the conversation, right? It's a very complicated, multi-layered, multifaceted topic. And I just appreciate that the conversation is opening up more to different points of view.
Well, thank you so much.
Thank you.
That was my conversation with Aaron Kimberly. Aaron has worked as a mental health clinician since 2008 in hospital and community settings. In 2021, he founded the Gender Dysphoria Alliance, which aims, in his words, to educate about different types of gender dysphoria from an evidence base without the lens of political ideology. He is also the co-host of the Transparency podcast. You've been listening to the Unspeakable podcast. I've talked a lot on this episode, so I'll go light on the sign-off here. I'll only say again that you can support the show by joining our Patreon community at patreon.com/theunspeakable. You can also make a one-time donation of any amount by visiting the show's webpage at theunspeakablepodcast.com and clicking the donate button. You can also leave a rating or a review wherever you get your podcasts, ideally positive. I'll be back next week with another super nuanced guest. Until then, thanks for listening. See you next time.